Why are some people's bladders more sensitive? Have you ever felt a sudden urge to go to the bathroom that seems to come out of nowhere? Or experienced discomfort even when your bladder isn't full? These sensations can be confusing and frustrating, and they often lead people to wonder why their bladder feels more sensitive than others. The truth is, bladder sensitivity varies widely among individuals, and many factors can influence how reactive your bladder is. Understanding these differences can help you better manage bladder health and recognize when symptoms might need medical attention. First, let's look at how the bladder normally works. The bladder is a hollow, muscular organ that stores urine until it's ready to be expelled. Its inner lining, called the urothelium, acts as a protective barrier, preventing irritants in urine from damaging the bladder wall. Nerves in the bladder send signals to the brain when it's time to urinate. In people with sensitive bladders, these nerve signals can become exaggerated, causing symptoms like urgency, frequent trips to the bathroom, and pain even when the bladder isn't full. Several common factors can make a bladder more sensitive. Infections like cystitis, which is inflammation of the bladder often caused by bacteria, can irritate the bladder lining and lead to increased sensitivity. Even after the infection clears, some people continue to experience lingering discomfort or urgency. Chronic conditions such as interstitial cystitis or bladder pain syndrome are characterized by ongoing bladder pain, urgency, and frequency. While their exact causes aren't fully understood, these conditions are linked to inflammation, changes in the bladder lining, and sometimes an increase in mast cells, which are involved in allergic and inflammatory responses. These changes can make the bladder lining more leaky, allowing urine to irritate the bladder wall and heighten sensitivity. Nerve-related issues also play a role. Overactive bladder occurs when the muscles of the bladder contract involuntarily, causing sudden urges to urinate. This can result from nerve damage, neurological conditions, or other health issues that disrupt normal bladder signaling. Structural changes in the bladder, such as scarring or fibrosis from chronic inflammation, can reduce its capacity to stretch. When the bladder can't expand properly, it may send urgent signals even when it isn't full, making it feel more sensitive. Age and hormonal shifts, especially during menopause, can influence bladder sensitivity as well. As women age, hormonal changes can weaken pelvic floor muscles, which support the bladder, leading to increased sensitivity and control issues. Lifestyle factors like caffeine, alcohol, and certain medications can temporarily irritate the bladder, making it more reactive. It's important to note that while increased bladder sensitivity is often caused by benign conditions, it can sometimes be a sign of more serious issues like bladder cancer. Symptoms such as urgency, frequency, and pain are common to many bladder problems. However, blood in the urine is a more characteristic sign of bladder cancer, though it can also occur with infections or other conditions. If symptoms persist or worsen, it's essential to seek medical evaluation to rule out serious causes. Diagnosing the cause of bladder sensitivity involves a thorough medical history, physical exam, urine tests, and sometimes imaging or a procedure called cystoscopy, which allows doctors to look inside the bladder. Treatment depends on the underlying cause and can include medications, lifestyle changes, physical therapy, or, rarely, surgery. Remember, bladder sensitivity is common and usually not a sign of cancer. Still, persistent or severe symptoms should always be evaluated by a healthcare professional. Many factors, like infections, inflammation, nerve issues, hormonal changes, and lifestyle, can increase bladder sensitivity. While bladder cancer is less common, being aware of warning signs like blood in the urine is important. Personalized medical advice is key, as each person's situation is unique. Maintaining bladder health involves understanding these factors and seeking timely care when needed. If you notice ongoing symptoms, don't hesitate to consult your doctor to get the right diagnosis and treatment plan.